Hello.
Hello.
So my name is Dr. Kevas and today I'll be doing an examination. It will be a full body examination. So what we are going to look at is basically your hearing, your skin analysis, then also your sensory perception kind of testing. Then we will also look at your back. We will be listening to your breathing and many other stuff. So first off, I will start with asking you several questions such as your name.
Hannah.
It's Hannah. Okay. How old are you, Hannah?
I'm 20.
20. Okay. Do you currently have anything that is bothering you?
Sometimes back pain.
Okay, back pain. And in which area is it? Is it in the
Up.
cervical spine? Upper?
Yeah, it's upper, like
Yeah,
under the neck.
Okay, under the neck. So thoracic spine. Okay, is it more in the middle or is it more like oriented into one side or the other?
Maybe more to right side.
Right side, okay. So thoracic spine, right side. Okay. Is it sharp pain? Like it's really kind of happening when you do some movement and it's just kind of like struck you? Strikes you?
Yeah, when I'm moving.
Okay.
Sometimes it's like sharp
Okay.
pain.
Is it when you bend or is it when you rotate to the side?
Rotate.
Rotate, right? Yeah, okay. So rotation. Good. Is that all that is bothering you?
Yes.
Okay, so do you have any troubles with your eyesight?
No.
No, okay. Do you wear glasses? Probably not, right?
No.
Okay, do you have any problems with your hearing?
No.
Okay, okay. So now let's just look at the skin. So I'll just move your hair to the side. Look at your skin. It actually seems very nice and clear. There are no blemishes. No acne. Your skin is not prone to acne, right?
No.
Alright.
But sometimes it gets dry.
Okay.
A little bit.
Okay. Do you do a skin routine of some sort?
Yeah, I use creams.
Creams, okay.
Which are for dry skin.
Okay, and daily probably, right? Okay. Do you use it only on the face or also underneath the jawline or also on your neck?
On all
On all
parts.
Okay. Okay, so the skin seems really nice and clean. I will just try how warm you are. The blood circulation. Okay. It seems that it's absolutely normal. Your hands do not tend to get colder, which is quite unusual for women actually. But it is how it's supposed to be. I'm looking at your skin and I can see that there is one scar and second scar. Did you have any kind of accident in the past? Or you don't remember?
I don't remember actually.
Okay. This actually might be from vaccination.
Yeah.
This one probably not. It's usually in this area. All right. Let's look at the other hand. Okay, I'm looking for any eczema, any rashes. I don't see anything. Okay, we'll just take your hand and look at the fingers as well. I'm looking at the color and texture. This is absolutely normal. Okay, I will just look between your fingers now. Okay, good. Now the other one, I can grab it like this. There is this one scar we already talked about. And look on the inner side as well. You have there a tattoo, okay. Good. And a few more others. Okay, now we'll just look between the fingers. Okay, turn your palm around. Okay, that seems to be normal as well. Okay, perfect. So you can have your arms like this. Can you just swiftly open your hand like this for me and just turn it this way? Alright, I'm looking at the skin right here. That seems to be normal as well. I can feel a few bumps on the back side of your hand. I will try it on the other side as well. Yes. So you have there a little bit eczema on the back side, or on the tricep area if you want to. It might be actually really a dry skin as well. I would definitely recommend to moisturize it with special creams for eczema. Absolutely. So otherwise, everything about your skin seems normal except this part on the tricep area. I will also look at your legs now. If you seem to have here any kind of eczema as well, that actually doesn't seem to be the case. Okay. Also look from the neck side. Nothing underneath your knees. Okay, that's normal. So I will look into your hair again to check the scalp and the skin there. I will just have to undo your hair now. So I will have to remove the pin. Okay, great. Now on this side. Okay, good. We'll take those sticks and just separate your hair and just okay, so it seems like you have some dandruff at the top part, or do you use dry shampoo? Sometimes happen also when we use dry shampoo, we get those kind of flakes. So I'm just wondering if it's dry shampoo or if it's just a dandruff.
I don't use the dry shampoo.
Okay, so it is dandruff. It's not very prominent, it's actually quite common. Do you tend to wash your hair quite often?
Not really. I don't wash them every day.
Okay.
I wash them like 3 times a week maybe.
Okay, so that's still quite a lot. Do you tend to get oily hair?
Oily? Yeah.
Yes. Okay. Okay, now I will do it from the other side. I will just turn your head a little bit here. Okay, so it seems to be only on the top, the dandruff. It doesn't seem to be anywhere else. Just part there, right here. Okay, so it's really just on the top. I will now palpate the scalp to feel if there is any bumps and lumps. Anything unusual. If you feel any pain, just let me know. Okay. Okay. I will now go to palpate your neck as well, from the behind. I'm also palpating the lymph nodes. I'll give you a glass of water. Here you go. And if you can just take a sip for me. Perfect. Thank you. That's great. I'll also palpate around the clavicles to see if there is not cancer. Actually, abdominal cancer can project on the clavicles, so it's really good to check in if you have the opportunity. Do you have any medical history in your family? Any kind of cancer or anything? Yeah? Okay. And who was it?
Who?
Who?
It was my mom's mom. My
Okay,
grandma.
so your grandma. Okay. Okay. Do you happen to know what kind of cancer was it? For which kind of part was it?
It was...
Okay. Just write it down. In case it is breast cancer, we will actually send you to a mammograph later, okay? All right. Great. So what we will do now is first off, I will be taking a listen to your heart. You don't have to breathe like anything like special. Just breathe normally. I'm not listening to your breathing. I'm actually listening to your heart and it's beating. So far it sounds normal. So go to the third quadrant. Again, sounds normal. And lastly here. Okay, that's normal as well. I didn't hear anything problematic. So we will go to the hearing examination. So I have here this tuning fork, which I will ring and it will sound like this. Can you hear it? Okay. Can you hear it here as well?
A little bit less.
A little bit less, yeah. It actually happens that with time it actually is vibrating less and less, so it will be like harder for you to hear it. So we have there a special place on the back of our ear where I will basically press this tuning fork, and you should be able to hear it not through the ear but through the bone conduction. So I will just ring it. When you stop hearing it, just let me know, okay? So I will press it right here. Can you hear it? Tell me when it stops.
No.
Okay. Can you still hear it like this? All right. Let's do it from the other side as well. Okay. Can you hear it? Tell me when it stops.
No.
Okay, can you hear it like this? Okay. Now I will press it into the middle of your forehead, and you should kind of hear and feel the vibration in both your ears. I want you to tell me if it's the same or if you hear it better on one side or the other. Is it the same?
I hear it better on the right side.
On the right side. And is it like a really prominent like difference? No, just slight. Okay. So it may actually be that either your ear is clogged, or you can actually kind of start to lose your hearing, which would be very unfortunate. So definitely go to the doctor and have that checked, okay? Perfect. Here we do just basic examinations and then we actually send you to the specialists. Okay. Good. Now we will proceed to sensory tests, which is I will be touching you with certain objects. One of them is going to be sharp, one of them is going to be dull. When you feel that it's dull, you will say dull. So dull feels like this. It also feels like this. Sharp feels like this, but also like that. All right. Okay. So I'll be using these four objects. You will have your eyes closed, no cheating. It's not necessary. It's actually to determine whether there is any nerve damage. So it's for your own sake to be truthful. Alright, so let's just start with this. So is it?
Dull.
Yes, perfect.
Sharp.
Yes.
Sharp.
Yes.
Dull.
Yes.
Sharp.
Great.
Dull.
Perfect.
Dull.
Yes.
Dull.
Perfect.
Sharp.
Yes. I will now lift your hands again. Keep them in the air.
Dull. Sharp.
I'll try one more time.
Sharp.
Yes.
Dull.
Yes.
Dull.
Perfect.
Dull.
Perfect.
Sharp.
Yes.
Sharp.
Yes.
Dull.
Great.
Sharp.
Wonderful. And here.
Dull.
Yes. Now I will just turn your palms like this. Perfect. So, like this.
Sharp.
Sharp.
Sharp. Sharp. Dull. Again. Dull. Dull.
Perfect. You can release your hands now, and I will go to your legs, and we will do it on your legs as well. So keep your eyes closed.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Yes.
Sharp.
Okay, perfect.
Dull.
Yes.
Dull.
Okay, that's great. Now I will take the tuning fork and I will be pressing it on you. The question is if you feel that it's cold. So you don't have to say cold. I just want you to be kind of like confirmative. So basically just confirm that it's cold. You can say either yes or you can say that it's cold. It's up to you. You can switch it up if you want to. Alright, so do you feel that it's cold? Cold?
Yes.
What about here?
Too.
Is that cold? What about this?
No.
No? What about this? Alright. What about here? Cold?
Yes, cold.
And here? What about here?
Less cold.
Or what about like that?
Cold.
Okay. And here?
Cold.
Yes, and here? Can you feel it over the socks?
A little bit.
Just a little bit, okay. And here?
Yeah.
Yeah, good, okay. That's wonderful. Okay, so now we will continue with the sharp and dull again. So,
Dull. Sharp. sharp, sharp, dull, 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 sharp, sharp.
Perfect. Okay. Is this cold?
Mm-hmm.
What about this?
Yes,
This?
yes,
And this?
yes,
This?
yes.
What about this?
Mm-hmm.
Okay. Okay. Okay, now we'll be palpating your spine. Tell me if you feel any pain. Anything painful?
Mm-mm.
All right. I will be pressing on each and every vertebra. So the spine seems to have a little bit unusual curvature around here, basically where your kind of lumbar spine starts. They tend to be a little bit sort of moved forward. So we would have you to go to chiropractor as well. Okay. So you said that your back hurt sharply in about this area whenever you rotate. I will now rotate you to the side a little bit. Is it this way, this side that it hurts? Okay.
Yes, this side.
And where exactly is it? Is it there or there?
Yes,
There? There.
No.
There.
Oh, yes, there.
Okay. And does it hurt when I press like this?
A little bit.
A little bit. Okay. Oh, did you have any accident, any fall lately?
No,
No?
it started after a workout.
Started after workout? Okay. What kind of movement were you doing?
I was doing
Rowing?
push-ups.
Yeah, push-ups. All right, that's almost the same movement. All right. I will now check the symmetry of your back, all right? And don't worry, it's actually normal to be a little bit asymmetrical in all of the aspects of our body, on our face, on our back. When I look at you from behind, I can actually see that this shoulder is a little bit lower than this side. So you're basically kind of like this. So we will maybe try to get you more into the center and be like this. Right, maybe a little bit lower. So this is basically the center. Okay. Anyway, I will be sending you to the chiropractor I'll be percussing now. Hearing okay, so right exactly where it hurts you. I can feel that or hear that the sound changed. There actually might be a pinched nerve, inflammation, anything like that. Okay, let's go here. Normal. I'm looking at the skin, the texture. The texture seems to be normal. However, there is about one particular freckle or mole that kind of doesn't look good at all. I would definitely have it checked. It's right here. It kind of has a very unhealthy color. So definitely I would send you to doctor with that. Otherwise it seems to be just normal. The symmetry is okay. Okay, I'll be listening now to the back. I'll take my stethoscope. If you can now breathe with me, inhale in and exhale out. 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 In and out. In and out. One more time. And one again. Okay. Okay. Let me now press on the muscles. Pressing on the spinal erectors. They definitely are getting stiff about from here. Okay, to there. So it's the thoracic spine that you overuse. The lumbar spine seems normal. It was again the right side. Again, the thoracic spine is very stiff in this area. Lumbar spine, again, it's getting normal. So it's on both the sides. Okay. I will now press symmetrically on the same spot and compare the stiffness of those points. So again, this spot was a little bit more stiff. Ironically, this spot was a little bit more stiff now. About here it's the same. Alright, what about on the shoulders? It's the same. Good, what about here. Alright, that's the same as well. Okay, so I will just give you your shirt. You can put it back on, and we are done with the examination. Okay, so I would definitely recommend you to go to a chiropractor to look at your spine in the lumbar area. I will actually write it down for you. And also, I want you to visit a dermatologist to look at the mole on your back, because it might be really dangerous for you to not have it checked in the future. So if you can go there as quick as possible, that would be great. Usually the waiting time is around 2 weeks to 1 month, but if you say that I have written you a prescription, then they will actually let you go a little bit earlier. Alright, and we'll just write this down, sign it, and you're good to go. Thank you.
Thank you.
Bye.
Bye.